Hi, this is the Global Health Leaders Conference at Johns Hopkins University, and today we will be talking about LGBT discrimination in OBGYN. So before we start, here's a little bit about me. My name is Jasmine. I'm a rising senior at Saratoga High School in the Bay Area. I'm an intern at Stop AAPI Hate. I'm the president of my school's Dear Asian Youth Club, which is basically like the Asian American Student Union. And I'm also an instructor assistant at Code with Classie, which is a camp dedicated to representing women and non-binary people in computer science. And in college, I hope to pursue public health and gender studies because I am an aspiring OBGYN. So let's talk about the purpose of our presentation. The purpose is to identify specific inequities the LGBTQ community faces in OBGYN globally, address disproportionate health impacts unique to the LGBTQ community, and open a discussion on how to make OBGYN a more equitable, inclusive environment for everyone. And now let's talk about why this is a global health issue. The LGBTQ community exists worldwide and experiences inequities everywhere. Same-sex relationships are banned in 73 countries with punishments as severe as death, and discrimination discourages LGBTQ individuals from seeking reproductive health care due to stigma around same-sex relationships, gender identity, and gender presentation. Now, let's just introduce our topic and talk about general inequities that the LGBTQ community faces today. So first, they have difficulties finding inclusive healthcare. Societal pressures and discrimination put the LGBTQ community at a higher risk for depression, substance abuse, eating disorders, and suicide. And lesbian, bisexual, gay, and transgender people alike see medical providers for various healthcare services, and yet a lack of LGBTQ competency and inclusivity lead to negative health impacts. So let's talk about inequities specific to OBGYN before we talk about their health impacts. So first, low fertility health literacy in LGBTQ patients, or knowing how to address and counsel fertility when it comes to lesbian, gay, bisexual, trans, or queer people, such as transgender men, non-binary individuals, and lesbian couples. There's also a lack of LGBTQ literacy, which causes LGBTQ patients to act as information centers to healthcare providers regarding their sexual health by talking about what it's like to be a gender or sexual minority and how that impacts their health, when in reality, the medical provider should be the expert. Third, cis and heteronormativity may make LGBTQ patients hesitant to seek care for fear of facing discrimination for not being cisgendered and or heterosexual. And lastly, LGBTQ patients lack access to healthcare providers who offer fertility services to them, such as IVF, IUI, or artificial insemination, etc. Now let's talk about how that directly impacts the health of LGBTQ OBGYN patients. A specific example is in Sao Paulo, Brazil, where healthcare providers would incorrectly label lesbians as infertile when they sought out infertility services. Second, a lack of long-term research in transgender OBGYN patients, such as transgender men and non-binary people, causes difficulties in counseling to those who seek out fertility services. Studies also suggest that approximately 30% of lesbian patients are unwilling to go to the doctor because they are afraid of being discriminated against for who they love. And lastly, pregnant lesbians are more likely to report unmet medical needs, chronic illness, depression, and high-risk behaviors such as binge drinking, eating disorders, and drug use as a result of the discrimination they face outside of healthcare. So with that being said, let's talk about how we can make OBGYN a more inclusive space for everyone. First is signage, so OBGYNs can hang pride flags or have signs making it clear that all genders and sexualities are welcome in an OBGYN office to make it more comfortable for not only the LGBTQ community, but also cisgendered and heterosexual patients who prefer inclusive providers. And second, and most importantly, is inclusive language. So avoiding hetero and cisnormative language when talking with patients and taking down medical history, which leads to not only better patient-doctor interactions, but also better health outcomes. So an example of inclusive language in OBGYN is when talking about periods. So for example, instead of saying when a woman gets her period, you could say something like when a person gets their period, because not all people who menstruate are women. And lastly, and also really importantly, increased LGBTQ education in academia helps non-LGBTQ providers be more comfortable treating patients of all genders and sexualities. So to conclude, the LGBTQ community faces discrimination and health disparities when seeking obstetric gynecologic care. A lack of LGBTQ health literacy and competency makes it difficult for the LGBTQ community to get personalized, high-quality care. Inclusive language, inclusive OBGYN exam rooms and offices, and LGBTQ health education are extremely important when creating equitable healthcare environments for all minorities. And lastly, more research needs to be done regarding LGBTQ patients as a whole to provide a higher level of LGBTQ medical treatment. And I will also want to thank the Global Health Leaders Conference at Johns Hopkins University for making this presentation possible, the scientists and researchers expanding our knowledge on this topic because it is so important as our world becomes more and more diverse. And I also want to thank inclusive OBGYNs and healthcare providers everywhere because they're making such a big difference on our community. And I also want to thank everyone watching because as future and current healthcare providers and professionals and community members, we all need to make a change and make sure that everyone feels accepted and comfortable in their community. So yeah, these are the sources I used. And thank you all so much for listening. If you have any questions, comments, concerns, my email is right here, so don't hesitate to reach out. Yeah, thank you.